Today is a huge day for Northland. It's the start of our COVID-19 immunisation program. We've got 300 of our border workers that we're hoping to vaccinate over the next 3 or 4 weeks. I want to really acknowledge them and their willingness to start this program. And then we've got 900 of their close contacts, family members, that we'll also be vaccinating over this time.
Well, it makes sense, the fact that we're exposed, being a borderline worker, we're exposed to the worst case, I suppose, the scenario where you're going on vessels, foreign vessels, and you probably need to, I feel that you need to protect yourself as best you can.
So my main reason is I'm hoping that if I get vaccinated and other people get vaccinated as well, it will sort of free up maybe travelling soon. Maybe it could help stop the spread of COVID-19, which means that we can all get back to a normal life everywhere, hopefully.
Right, you ready? Keep that arm nice and relaxed.
We're really committed to strengthening our healthcare workforce vaccination skills and training, and so there's a program of increasing the number of vaccinated workers within Northland. So currently we have 180 of those workers and they are already trained, and we're hoping to train significantly more. We need to train particularly for rural areas and in our Māori workforce, and so we are thinking carefully about how we can do that. What we want to see is a workforce that actually represents the communities that we're vaccinating within.
Simple reason is that's the right thing to do as far as I'm concerned, and being the operations manager and with the leadership team, you get the ball rolling with you so that the rest of the staff feel confident and comfortable in the process, and they follow suit as well. It matters greatly to the nation itself, and border workers already are trained and well versed in their own requirements of wearing their PPEs and looking after themselves with the distancing and everything. With the jobs that they do get in touch with international crews and stuff like that. So it is important that they be vaccinated, and mostly to allay their own fears that, you know, that they're not the carriers of the virus to anybody else. So by protecting themselves, they are in turn protecting the rest of the country.
I have family, I've got grandchildren, I go home, they come visit regularly, and I would be devastated if one of the kids got contracted it because I didn't take all necessary precautions that I could to prevent this from happening, you know what I mean? So it is a concern from that aspect. I just hope that doing the best I can to protect myself and the people I come into contact with.
I encourage all Northlanders to consider being vaccinated when you're offered the vaccination. This is a huge opportunity for all of you to protect your families and whānau and be a kaitiaki for your whakapapa. Talk with your GP or your Māori health provider if you need more information, or call the Immunisation Advisory Centre 0800 Immune